Hello and welcome back to today's show. I'm Jen, in for Helen. It is 4 minutes past 2. You're listening to Afternoons here on DubaiEye 103.8. And from fatherhood to family planning, because news this week that a new experimental male contraceptive pill has passed its first human safety trials. It's being greeted with quite a bit of optimism, I would say, by the community here. The hormone-free drug, currently known as YCT529, it's not catchy, works by reversibly reducing sperm production. And while it's early doors, first human trial showed no major side effects, hormone disruption, mood changes or cardiac risk. So after, I would say, decades of headlines and hope about an alternative to a traditional female contraceptive pill, are we actually finally getting somewhere? I am joined right now on Teams by Dr. Luciano Nardo. He is a consultant in reproductive medicine and infertility here in Dubai. And Dr. Nardo, first of all, this study's getting a lot of headlines, but it's worth saying it is a very small sample of men at this stage. How significant is this study in the context of male contraception research?
It is indeed a early study. It is not a study that can be used, and findings from this study can be implemented in a routine clinical practice. So we are indeed at the very early stage of discovering the place of male contraception. And it is indeed exciting because we know that at this point in time, male contraception only rely on the use of condoms, which per se has got a 10 to 15% failure rate. Otherwise, vasectomy is a surgical procedure, is invasive. It is in some cases reversible, but certainly is not the same as would be the pill.
And so can you explain to me how this drug works and why the sort of specifics of this drug are being seen as such a breakthrough?
It is important, actually, that we highlight that any form of contraception should be, for the purpose of family planning, should be a temporary solution rather than being a definite solution. And the reason why there is a significant body of interest around the use of YCT529, which is a retinoic acid receptor antagonist, is because it has got non-hormonal action. And the mechanism of this compound seems to be predominantly dysregulating or disrupting some testicular signaling that could potentially be reversed, and for a temporary period of time, just reducing sperm production.
Now, you mentioned there that it's hormone-free, and I think we've seen a lot of headlines over the years about male pills that were being tested. We've seen trials abandoned because they had such bad side effects for the men. It seems as though a lot of those ones that have been trialled in the past have been hormone-based. Why is it such an important aspect to this one that it is hormone-free? Is it just about the sort of the ability to reverse it, or is it also about the lack of side effects? Both of them, I guess.
Yeah, exactly, Jen. I think it's both of them. Any form of contraception, as mentioned, should be reversible, especially in this day and age. And the concern of any hormonal influence will be the potential long-term effect on spermatogenesis, which is the production of sperm. So the fact that it is hormone-free, I think, is likely to cause less side effects in the short term and in the long term, but also most likely to have a much more reversible effect once the contraception is stopped.
And so obviously it being non-hormonal means we don't get those hormonal side effects that we've seen in other studies, sort of headaches, impact on libido. There was some heart risk in some studies. But this is a very early trial. Are there any side effects you might be expecting from this drug that we need to watch out for? Are there any potential downfalls to this one that we still need to be aware of?
There are no the small study has not shown any downfalls. I must say that actually the study has also been conducted in a small population. However, there were some preclinical trials conducted on mice and also non-human primates. They haven't shown any side effects. And this is very important that we also mentioned today that the studies are looked at the potential development of side effects in a population that was assessed for less than 120 days. So we don't know if in the long term there will be some side effects, but at this point in time, based on the findings, there are no side effects.
The other thing that sort of struck me about this trial, apart from, as you say, that it was quite small numbers, was that all of the men who were involved in the trial had already had vasectomies. And that's obviously sort of, from an ethical standpoint, it wouldn't be good to test these drugs on men who still plan to have families. So, you know, to be able to see if it's reversible, we need to trial it. But I wonder, how much would you expect that to skew the results? You know, would you expect men who hadn't had vasectomies to experience this medication differently? And how do we do that next stage testing when there is that risk that it couldn't be reversible?
I think this is a very valid question, Jen, and one that I would ask myself if I was to consider taking this as a contraceptive method. The study is very small. It's an early study. The population may not be perhaps the best population to be tested for these purposes. I think we need to have in most clinical trials a wide population with a wide range population. So I would expect to have young men in the perhaps 20s, as well as older men in the 50s, to see the potential effect and the side effects in the wide spectrum population.
And so would that be the next stage of testing normally with a drug like this?
Absolutely. I think I assume the investigators, and I am also confident that multiple studies will come on the back of this initial study. We'll be looking at different populations, not just in terms of age, but also in terms of ethnic background, and indeed looking at men that may have underlying problems to see whether actually the side effects may not be manifested in some men, but may be manifested in other men.
Dr. Luciano's staying with me, so if you have any questions at all for him, do get them in. 4001 on the text, 04871 5500. I want to get into the wiser picture next, Dr. Luciano, and the potential for this drug for a lot of the couples and families that you work with, but we've just got to take a very quick pause right now to take a look at the roads.
DubaiEye 103.8 traffic.
With Yas Island Abu Dhabi. Stay at iconic hotels and play at record-breaking theme parks. Book now on yasisland.com.
How is it looking, Milani?
Hello, thankfully, Jen, no accidents this hour in Dubai. Just a bit of a slowdown on the E44 Al Khail Road. So that is the traffic coming from Al Quds Industrial Area 4 until you reach near Jumeirah Village Circle or JVC. And then now looking on the E11, Sharjah area between Al Nada and the area near Oasis Mall in Sharjah, very slow there from Sharjah to Dubai traffic. So it is from Bushagara area until Al Nada 1 in Dubai. Now on the E311, the Sheikh Mohammed bin Zayed Road, heavy traffic coming from city center Al Zahia area until, this is long, until Muhaisna 1 in Dubai. Now on the opposite direction from Muhaisna heading to Sharjah, just light to moderate traffic until industrial area 15. So if you want to add anything else, you can text us on 4001, but please only if it's safe to do so. Please drive safely.
Thanks so much, Milani. And as Milani says, please do drive safely. If you want to get in touch with us, pull over first. Please don't text us while you're on the move on Sheikh Zayed Road.
DubaiEye 103.8 traffic.
We are discussing early stage trials of a new male contraceptive pill today that's making global headlines. I am joined by Dr. Luciano Nardo. He's going to be staying with me, so if you have any questions whatsoever for him on all things reproduction and infertility, get them in 4001 on the text, 04871 5500 on WhatsApp.
This is DubaiEye 103.8.
The UAE's #1 talk radio station.
Elton John there and Dua Lipa. It is Cold Heart. We are discussing early stage trials of a new male contraceptive pill that's making global headlines today in what's being hailed as a major breakthrough. Early stage clinical testing of a new drug labelled YCT529 was successful in temporarily reducing sperm production in men who had had a vasectomy with very few side effects. So, after decades of headlines about a male pill and nothing coming to market, could this potentially be the game changer we've been waiting for? I am still joined by Dr. Luciano Nardo. He is a consultant in reproductive medicine and infertility here in Dubai. And Dr. Nardo, I wonder if this drug does prove effective long term, and there's still a lot of testing to go, but assuming it does, how might it change the picture for the patients that you're working with every day? Oh, Dr. Nardo, are you? I can't hear you.
Sorry,
there you are. Were you on mute?
Yes, I was on mute. So will be a significant change. Until now, we are used to prescribe the pill for women, and we know that is a reversible contraception method. Men have only two options, as mentioned earlier: either condoms with a degree of failure rate or surgery, that being the vasectomy, that albeit reversible. However, it is not always an effective solution. And most men requiring fertility treatment post-vasectomy, they will end up seeing me in the fertility clinic. So I think if these are YCT529 proves to be an effective solution, certainly will change the game in terms of contraception, not just for men, but I think for couples.
I'm really interested in what you say there about men who come to you because they're wanting to reverse vasectomies or because they need fertility treatment after doing that. Why do you find that men are coming to you having sort of wanted to reverse a vasectomy? Have they had it because they've not had other options early, or is it because their life and their sort of needs has changed over time?
I think a combination of the two, Jen. Some of them, they come back because the family circumstance, the needs, the priorities have changed. They may have had a previous family, completed that family, and made a decision that no more children were going to come into their life, and then met a new partner and wanted to start everything again. And some other men, they were considering contraception and they didn't have any other solution. So provided the pill is effective and doesn't have any side effect, such as mood swings and changes in sexual desire or erectile dysfunction, I think will definitely be a significant change in contraceptive medicine.
And I mean, you mentioned some of the side effects there that we're hoping won't occur, and 2 out of the 3 there do occur for a lot of women who are taking the pill. I think we kind of often look at fertility issues and contraception in a very sort of female skewed way, primarily, I guess, because a lot of the responsibility up till now has fallen on women because of access to the pill. What sort of change do you think it could make for the couples that you're seeing to see the ability to see contraception as a sort of equal opportunities responsibility? What would the wider implications of that be?
I think when we have to think about the role of the contraceptive pill in women only for contraception purposes. The reason being is that in proportion of women coming to see a gynecologist or fertility specialist, they will be prescribed the pill not for contraception purposes, maybe to regulate their periods, maybe because of underlying conditions such as endometriosis or painful periods, or simply because they want to adjust the lifestyle during a certain period of time. So the contraceptive pill for women is more than just contraception. Mm-hmm. For men, I suspect will just be exclusive for contraception purposes. But clearly, for couples that are planning to put on hold on their family planning, men will be also playing a role in the decision making, and they can take the first step perhaps before women when it comes to start taking the pill.
And you mentioned there a lot of women, as you say, are on the pill for lots of different reasons, not just for contraception. But there are, as I understand it, sometimes times where it can take quite a while to come out of a woman's system if she's been on it for a very long time, where you don't immediately necessarily have the best chance of conceiving if you've just come off of the pill after a very long time. What sort of picture do you think this could play in family planning and in that fertility picture if we had a reversible contraceptive for men, so that women perhaps weren't needing to be on the pill right up until the point of wanting to start a family?
Will be exceptional. If women do not need to take the pill and for contraception purposes, or may choose to take the pill for a certain period of time because the partner is taking the pill for the remaining part of the family planning period, I think will make a significant difference. Women will not feel that they are the only one having to contribute to postponement of pregnancy.
And so, assuming that this drug were to clear the next stages, I mean, all the signs at this point are very good, but there's still a long way to go. What sort of timeline are we looking at where this potentially could be something that the couples you're seeing could consider?
I think we need to be very clear in this context, Jennifer. One, we don't know exactly as yet the dose. Mm-hmm. What is the right dose for contraception purposes? And what is the right, whether there is a dose that is depending on body weight, is depending on ethnic background, also whether there are some contraindications to taking this pill. So I suspect that a number of clinical trials will have to be conducted. And although the initial one has obviously shown some positive and encouraging findings, but I think we are probably 3 to 5 years away from prescribing this pill to men coming to the clinic.
3 to 5 years, that's less than I thought you might say, actually. And I mean, I mentioned earlier we've seen headlines for years and years and years and years that, there could be a male pill coming, there's this trial, there's that trial. There are a number of other drugs sort of going through the process at the moment. Are there any others that you would say are as exciting as this one? Why is it that this one is generating the degree of headlines that it is?
I think this is probably the most exciting at this point in time. But I also like to highlight that we are now talking, and the studies focusing on side effects as adverse effects from taking the pill. But I think what future studies will have to look at is whether there is any safety concerns on the sperm. So by taking the pill, will the sperm, the DNA fragmentation of the sperm, and the ability that the sperm will have to fertilize eggs remain intact? We don't know that. So that's the reason why several studies will have to be conducted, not just to look at the population, the men taking the pill and the potential side effects, but also the safety and potential changes in sperm parameters.
And of course, there's a psychological aspect to that as well. This is all very new, sort of I think there's a fear of the unknown. This is not a normal thing for men to be considering taking contraceptive medication. Last question, I've only got a minute with you, but I wonder, what do you think you would sort of have to advise patients and discuss with them to make sure that this is the right thing for them? What concerns do you think you would come up against with the men that you treat with this idea?
If the clinical trials have shown that no side effects and no concerns about sperm parameters post-pill, then I would not actually, I would not be adverse. I would not be recommending a vasectomy or continue to use condoms. I think if this is safe, I would encourage men to take it, as I encourage women to take it. But the exact point, Jen, is how long should they take it before could potentially cause some problems.
Mm-hmm. Lots of tests still to go. That is Dr. Luciano Nardo. Thank you so much for your time, Doctor. It's such an interesting topic, and one I'm sure we will come back to when we see the next round of trials. If you want Dr. Luciano Nardo's details, send me the word pill on the text 4001. I will send you all of his information. We're going to be staying with this topic next and asking how this could help couples where maybe a woman is struggling with existing pill options and what this could do in that picture. I'm going to be joined by OBGYN Dr. Samina Dornan after the news headlines.
Your ARN News.
A delegation from Moldova, including the